that we are done making the closed bed, open bed, and anesthetic bed, we will then proceed to the last part of bed making, which is bed stripping. So, bed stripping is done after a patient is being discharged from the hospital, which we are going to remove all the soiled linens one by one from the bed. So, before starting the procedure, we must make sure to prepare a laundry basket or a hamper in which where we can place all the linens in the procedure. So in starting, we must have to remove the pillowcase from the pillow. And in removing the pillowcase from the pillow, we must hold the pillow inside, since this portion of the pillowcase is the one that is soiled, for it is in a direct contact with the patient. Now we just have to fold it back to hide the soiled part of the pillowcase.
Good.
Now we must make sure that the soiled part should be turned inside the pillowcase. Then we are going to fold the pillowcase. Then after that we have already placed the pillowcase in the hamper, we will then proceed to untucking all the linens by using our hand to remove all the linens and the other one to hold the mattress. Now that all the linens are already untucked, we're then going to remove first the bedspread. So in removing the bedspread, we must make sure that we hold the wrong side for the other part of the bedspread, since this portion is the one being most likely to get in contact with the patient's family or the health workers. So with this, we are going to pull the inside of the bedspread and place it at the center, or place each side to the center, forming a ball. And after this is we are going to place it to the hamper. Now the next one to be removed is the blanket. So since the blanket is not most likely to get in contact with the patient and as well as the health workers or the family, we can reuse this blanket. So in order for us to reuse the blanket, we must fold it properly. So by folding the upper hem, and then the other hem, fold as well towards the center, just like what we did in the upper hem. Then we have to fold it together. Now after that it is fold together, we're going to pull this side and fold it towards the center. And then fold again. So after that we have folded the blanket, we're then going to place it somewhere clean so that we can reuse it. Then after the blanket is placed somewhere clean, we'll then proceed to removing the top sheet. And in removing the top sheet, since this part is the one that is not in direct contact with the patient, and the other part is the one that is soiled. We are going to pull the center and gather the sides. Now we are going to place this to the hamper. Now in removing the bottom sheet, since this part is the one that is soiled, for this is the one that is in a direct contact with the patient, we are going to remove it in the same manner as what we did with removing the bedspread. So we are going to fold it in the wrong side, pull each side and place it to the center. Pull. And place it to the hamper. So now that we have already finished removing all the linens from the mattress, it is now the best time to check if there are any needs for repairs or are there any thorns on the mattress. And also, it is the best time to air the mattress or the bed by placing the mattress at the head part of the bed. So when the patient that occupied the bed has no signs of communicable diseases or has no communicable diseases, then we can air the bed for about 2 to 4 hours. While when a patient has a communicable disease, then we have to air the bed, clean the room as well as the bed, and disinfect it for about 24 to 48 hours before we make it available for the next client. Now after that, we are going to bring the hamper with the soiled linens to the laundry room for washing and disinfection. That would be all. Thank you.